Hello, good afternoon, everyone. Thank you for joining us. It's my pleasure to welcome you today to Social Work in a Time of COVID-19, International Lessons for Practice. Today, we will be hearing from social workers all around the globe to share how they practiced during the pandemic. My name is Mariam. I'm a qualified social worker in the UK. I'm also a social work lecturer for the Greenwich University, and I am part of the steering group for disaster-based social work with BASWA. So just a little bit of housekeeping. As we progress through the webinar, we do want to hear from you. We know some of you joining us already have knowledge and experience about what we are discussing today, or you may just have questions about the information being shared. So we want to hear from you. So please do use the chat box to get in touch. We are encouraging those who are on Twitter to use Twitter during the session, and the hashtag for this is WSWD 2021 or World Social Work Month. So without further ado, let's begin with the introductions. So owing to issues of internet connection, the main presenters are pre-recorded for today's session, but the speakers are available for questions and answers afterwards. So we have Jacob from the International Federation of Social Work. Second up, we would have Gayanti, social work from India, and Limaya will be joining us for a Q&A to answer any questions about Gayanti's presentation. And then our final speaker is Stefano, who is a social worker from Malawi. So first up, we're going to hear from Jemko, who provided a recording in which he gives general reflections on the World Social Work Day 2001 theme, which was Ubuntu and its importance in relation to social work.
Okay, so greetings to everyone that is listening in and watching us. My name is Joachim Cuthbert Mumba. I'm the Vice President of the International Federation of Social Workers Africa region, as I'm basically speaking to the concept of Ubuntu. In terms of the origin, Ubuntu best described as an African philosophy in Zulu pronounced as Ubuntu, is a Nguni Bantu term meaning humanity. It is often translated as I am because we are, or humanity towards others, or in Zulu, Ubuntu, Ngumuntu, Ngabantu. So it is a social and humanistic ethic. The belief in community, the belief in collectivism. Then we see that Ubuntu became so prominent in terms of talking about it post apartheid era in South Africa. And I can point to a number of people that have been proponents of Ubuntu, that have written about Ubuntu, like Archbishop Desmond Tutu of South Africa, who describes Ubuntu as, who describes a person with Ubuntu as a person or as a being open and available to others, affirming of others, does not feel threatened that others are able and good, based from a proper self-assurance that comes from knowing that he or she belongs in a greater whole and is diminished when others are humiliated, or diminished when others are tortured or oppressed. So this is how Desmond Tutu described Ubuntu, or a person with Ubuntu. Then we also see Nelson Mandela explaining Ubuntu through a story about a traveler through a country and would stop at a village, and the traveler did not have to ask for food or for water, because the community, or wherever the traveler passed, the community were able to welcome that particular traveler, and without asking, they would give food or water to the traveler. I am because we are as a community. I am because we are as a family. So it's the concept that promotes interdependency, the concept that promotes, connectedness, the concept that promotes solidarity. Then we also see the former US President Barack Obama. He once said, he talked about Ubuntu and said that there is a word in South Africa, a word that captures Mandela's greatest gift. His recognition that we are all bound together in ways that are invisible to the eye, that there is oneness to humanity, that we achieve ourselves by sharing ourselves with others and caring for those around us. So that's very critical. Again, when you look at the example that Nelson Mandela exhibited or showed, Nelson Mandela was able to introduce his jailers, those people that persecuted him, that jailed him for over 27 years. When he was now being inaugurated as president, he was able to introduce his jailers as honored guests at his inauguration. So it can only be because of Ubuntu, and that Ubuntu values life. It values dignity. It values, compassion, humanness, harmony, and reconciliation. And again, when you look at all this, you can see the examples of, post, apartheid South Africa, when the government of South Africa then instituted what they called it was called the commission, I think, on reconciliation. And what you saw is that those that were perpetrators of the vices and apartheid were not necessarily tried in the formal courts, but they went through under the commission that was looking at reconciliation, and there was no vengeance, there was no retribution. And also when you look at post-genocide Rwanda, again, the perpetrators of the genocide also were tried in the community courts, where the spirit was about reconciliation, and the spirit was about rebuilding the lost or the fractured relationships. So in South Africa, really, it was called the Truth and Reconciliation Commission, and that really was guided by the spirit of Ubuntu. And again, we see that there are key maxims that guide the concept or the philosophy of Ubuntu. And the first one is, again, not in order of priority. The first one would be that to be human is to affirm one's humanity by recognizing the humanity of others, and on that basis establish respectful human relations with them. Yeah? So I will repeat that. So the first maxim about Ubuntuism or Ubuntu is that to be human is to affirm one's humanity by recognizing the humanity of others, and on that basis establish respectful human relationships with them. Okay, and the second one is if and when one is faced with a decisive choice between wealth and the preservation of the life of another human being, then one should opt for the preservation of life. So the philosophy of Ubuntu has been passed on through different modes, through proverbs, and through different modes. Like in the olden days, there is what in my country, or rather in my culture, what we used to call Mphala or Nsaka. So Mphala was like a place where you would bring young men or young boys, and then they would sit with elders and then there will be, taught about the tradition. They would learn different skills and so many things. And these young people or young boys would come from the community and sit with elders to learn different things. Again, that was also the spirit of collectivism or collectivity within the community. And also the different proverbs that we can give as examples. One example of one proverb is mwana wa mzako ngwako, or mwana wa mzako ngwako yemwe, ukachenjera manja udya naye, meaning that your neighbor's child is your own. His or her success is your success too. So, we've grown up, or we used to grow up in a community, especially in villages, where as a child, every elderly person will take you as their own child. If they find you like you're being beaten up or you are being attacked, an elderly person would come in and intervene, because they would not take you as probably somebody they don't know, they've never met, or even if they don't know you, as long as you're a child, they will take you as their own, child. And you would see that this, the concept of community life, the community concept of togetherness was very strong. And again, that all was guided by the spirit of Ubuntu. Okay, and children were considered as a responsibility of the community, or the responsibility of any other elderly person within the community. And again, that's where you see that in our setting, the concept of uncle or aunt, was never there. Okay, and even now, it is still, being regarded as a foreign concept to regard a person as an aunt or an uncle. So what was common was that any elderly person within the community would carry the father figure, that is like if they are male, or the mother figure, that is if they were female. And like my father's brother would of course be my father, or referred to as a father, or my mother's sister is actually my mother. So there was nothing like this one is my aunt, this one is my my uncle. And that really helped in terms of strengthening the the extended families setup. And then that's where you find that in the olden days, except for now that there is some set up. In the olden days, the care of orphans was not left to orphanages. We never knew anything to do with orphanages or child care facilities. If, say, I die today, my children would definitely be taken care of by my sisters or my brothers. Basically, that was the spirit, And also there is this proverb in my language. We say chala chimodzi sichitola nsabwe. In English, it says one finger does not pick a lice. So there is a belief about togetherness, doing things together. But again, as I said, you would see that this is just a concept, it's just a philosophy, and it requires kind of maintaining. It requires passing on to the new generation. And but again, there's so many challenges that our communities nowadays are facing. One, there's a lot of Western influence in terms of different philosophical worldviews, like the philosophical worldview of individualism. This is kind of like impacting on the spirit or the philosophy of Ubuntu, as people are adapting the Western styles of looking at things, the Western styles of living in the community. And also we see that poverty is also taken toll of our way of doing things. the economic challenges that so many people in our communities are facing. So that is taking toll on the spirit of Ubuntu, as for instance, the economic challenges are breaking down the extended family systems, and people are no longer looking at, for instance, taking care of orphans when somebody passes on. But again, we are not saying that the whole concept or the spirit of Ubuntu has been eroded in our communities. There's still some elements, and we're still trying as Africans to see how we could sustain Ubuntu, because we believe that it helps to create solidarity within the community. And another example I could give is that if there is a funeral in the village, you would find that it's not really the responsibility or necessarily the responsibility of the family or the bereaved family, to or the family of the deceased to bury the dead or to do all the funeral rituals. The community comes through. If there is a need for food at the funeral, the community will mobilize the food. They will mobilize the resources and provide support to the family of the deceased. So this all is about Ubuntu. And again, coming down to social work as a profession, I think there's a lot that social work as a profession can learn from this. And I think for today, I may not go in detail into that. But what I just want to indicate is that social work needs to tap into the existing way of doing things within the communities. For instance, if a social worker is intervening in a particular community, the first thing first is to look at what are the what are the resources that this particular community has. And first of all, the resources that we should be talking about is the community itself, it's the people within the community. There could be one person with a challenge or with their problems or social problems in that particular community, but the solution may not necessarily be coming from the social worker who is an outsider. But the social worker should be cognizant of the fact that the solutions or the resources could be within the community. But all we need to do is to see how do we strengthen the community, how do we strengthen families, how do we strengthen the individuals within the community to be able to help themselves. So I thought that is what I would share for now about the concept of Ubuntu. And as I said in my opening remarks, that it's really been quite difficult to define Ubuntu. But I think the only thing that we've tried to do, and quite a number of people have tried to do, is to describe what Ubuntu is through telling stories, through telling, giving examples, and also listing down, for instance, some of the key elements of Ubuntu, like solidarity, compassionate, being kind, and things like that. So for now, I think that is where I would end, and we may need to go deep into this conversation and try really to bring out other critical aspects of what the philosophy entails. Thank you so much for listening. And
Jake. Okay, thank you very much for that, Jacob. Some very interesting reflections, particularly about the history of the word that we may not have known, delving a bit deeper into its origin and sharing some of those beautiful sentiments about humanism and collectivism. That was really beautiful to hear. So thank you very much for that. Next up, we have a presentation from Gayanti, a social worker in Kerala, who talks about working with tribal people in the time of COVID-19.
I'm Gayatri Klatil Suji. I'm a social researcher fellow. I'm working with MS Samidaran Research Foundation. which is based out of Kerala, southernmost part of India. This pandemic, corona pandemic, have affected the whole world, and developing country like India have the corona have affected India a bit more in a vulnerable way. Uh, so we have been trying to find out how the village life of Wayanad, the place, a mountain or hill region of Kerala, India, have been affected by the COVID-19 pandemic. You can see a picture on the right side that the mountain place is one of the tourist destinations also. And most interestingly, it is a place where the lot of tribal population study has been have been done in two different. We have used two different methods, that is quantitative and qualitative impact of COVID-19 on the village life of Maya. So the main primary objective was basically we have selected these two communities for doing our study to finding out how COVID-19 have impacted the village life of the Wayanad, and we have taken three different areas to study. One is how their household income was affected, and secondly, how their agriculture part, farming part was affected, and finally, how their food system was affected. The Paniya community was once bonded laborers. They were actually considered as the most lowest part of the society. They were only used for the labor purposes. They were actually the humans, Paniya humans. Actually, they were actually sold for farming purposes. That was the history of this particular community. And they are having the majority in this particular area, in this particular district of Wayanad. And as I mentioned earlier, there are a lot of other community tribes like Piniyas, Kurumas, Kurichias, Katanaikas, Adiyas, and Urali Kurumas. So compared to all other communities, these are Paniya community is the most vulnerable community, and there are a lot of prominent problems we have noticed. Among them is alcoholism, also the lower educational level in the community. Majority of the children are dropping out the school before completing their primary or secondary education. In their 2nd standard, 4th standard, 8th standard, majority of the children are not even reaching their 10th grade. Before that, these children are dropping out from the schools, and majority of the men in the community are the victims of alcoholism, and they're economically backward. Majority are landless. They were actually traveling community. Basically, they move from one place to another place. They don't have a permanent residence. So these are the background of this Paniya community. This is the community we have done our study on. Also to mention, they have been living in total unhygienic living conditions, especially in the case of women. When we take their reproductive hygiene, then we look into their menstruative hygiene. That's a basic background of the Paniya community. That's how they come up from the conditions they have been living now. But there are no much differences to their living conditions even today. So that's the reason why we have chose this particular community, and we were very much interested to know how this pandemic situation have affected their community or their malnourished community. And the challenges basically they faced was job unavailability, and and the present scenario, even after the lockdown, they are unable to find the job. That is one side, and the second side is that these people are fearful to go for the work. That's the second part of it, and due to the COVID, and especially when we speak about the gender part, there are women who are staying in the home were not going to the work even after opening the lockdown scenario, even after releasing the lockdown. It is because of two components. One is The oldish people was staying in their home. Secondly, the schools was not reopened for their children. So these women cannot go to work because they are supposed to, or not they are not supposed to. They are like they have to look after their children. They were like they had no other options left. So they have to look after their children in the home, and they were stuck in their homes, so they couldn't go for work or anything. So that is the condition of women. Basically, in Paniya community, women and men equally go for the jobs. But after this lockdown scenario, women population could not go for work because they have small children in their homes. That's the condition of women. And alternative income. When we speak about alternative income, they were unable to find any sort of income sources during this 4 or 6 month scenario. Community people from this community are already vulnerable. They are already going through a lot of lifestyle diseases like diabetic, blood pressure, and a lot of other conditions. Above all, they have the history of malnutrition. These people are basically reluctant to go to the hospitals. And we also looked into the another factor, mental health factor, that is anxiety and fear factor. We had made another set of questions to understand how they had been facing what all things they have been facing. This infected, they were actually afraid. They were really conscious because they are already medically vulnerable. They had the history of malnutrition, so they were very much fearful when compared to the other people. And anxiety regarding the income generation was comparatively less. So this is one of the photograph which is shown on the right hand side. We were conducting our study. And we met an old woman and a small child doing our data collection. These people mostly depend for their food in the normal, like in their locally available foods. Like they'll be eating leafy vegetables, spinaches, jackfruit, papaya. Even during the lockdown, before the lockdown, even after the lockdown, these people are looking. They'll be. They always prefer buying, not buying. They prefer collecting vegetables from their surroundings. They have that forest. They have the history of forest dwellers, and they always try to avoid buying vegetables from the shops. So during lockdown, as I mentioned earlier, they had option of getting ration. Plus, they were getting a lot of kits from the government. Plus, that the scarcity was for the vegetables and the meat, milk, and fish items. But they managed it. They were not tensed about any of the things because they always plucked leafy vegetables. They always collected food items from their surroundings and the nearby forests, nearby streets, near the rivers, near the streams, and everything collected their own, and they tried to cook their own food. And one of the major issue was reported from there and was getting the availability of alcohol and the tobacco. Even the 3-year-old, 4-year-old kid will be chewing tobacco throughout the day. You can, when you go to a Paniya community, that is a one sadful scene you will be witnessing. 3-year-old, 4-year-old kids to 90-year-old, 100-year-old grannies or grandpas will be chewing the tobacco. That is their inbuilt habit. It will be it is an inbuilt habit in this Paniya community. So that is one of the saddest part reported by community friends. They were not finding any tobacco in the shops. They couldn't buy alcohol during the lockdown scenario. That was one of the cases reported. And there is their life expectancy, especially men. The expectancy of men is less compared to the general society. Another studies also proven that is due to the over alcoholism. Due to the alcoholism, this men's life expectancy is reducing compared to the general society in the whole of the state. So that is one of the major problem, and that was their problem too during the Corona time, unavailability of tobacco and alcohol. Now we'll be talking about farming community of Wayanad. This is one of our survey participants. You can see the image on the right hand side. We'll be focusing on banana cultivating farmers, because they are the farmers who are worstly affected by the COVID-19 pandemic. Because banana is a seasonal food, and they will be cultivating it for the purpose of festivals. Because before lockdown declared, that was a month supposed to be happen. Kerala is one of the major festivals. So these farmers were cultivating banana to meet this festival's need. They were cultivating because they will get a good income when this festival is coming. So when they impose the lockdown scenario, all their expectations went nowhere, because they couldn't sell their bananas. They were cultivating thousands and 2,000, 1,500. Farmers were cultivating 500. Everybody was cultivating a good number, huge number of banana plantings, and everything went low. And there are some of farmers were actually doing dairy farming, and they went under quarantine. They were actually primary contacts of COVID-19, and they went under quarantine. This is one of the case that I'm explaining. So this particular farmer went under quarantine, and he had cows in his home. His 14 to 15 liters of milk was literally, he was pouring down into the land. So these are the problems which have been faced by our Paniya Adivasi tribal community, and by the farming community. So we have been trying to implement lot of projects, projects which are supporting their income generation, and for their sustainable income generation. So during lockdown scenario, we had made a mask making unit for the Paniya woman. So this woman who was taught the skill of tailoring, they were actually making mask production, so that at least sitting in their homes, they can actually make a few masks and they can sell it to the society. So that is one of the initiative which was done during the lockdown scenario, and even after lockdown, the unit is still running successfully. And secondly, we have built up an education center for the tribal children. It is because, as I mentioned in my slide earlier, this tribal, especially this Paniya, children from the Paniya community, majority of them are school dropouts. Maybe in one of the community we implemented this education center, 50% of the children are school dropouts. They have dropped out from school from 7th standard, 4th standard, 8th standard, and they at the age of 15, 16, some girls will get married illegally. They'll get married, and some will get married after 18. They'll be continuing. Earlier they were bonded laborers. Now they themselves are following the yellow collar jobs. They couldn't come out from their situation even today. So it's majorly because they're not completing their primary education. So these children are not going. You can see one of the photo on the right hand side. That is one of our community center, and those are the books which was donated by the public to these children. We have did a book campaign, and lot of people, thousands and thousands of books we have received, and these children are opening these books themselves. So we are setting up a library, kind of education center for them, and we are doing the reading helping measures, writing helping measures. We are indulging games into the learning, so that it will make more interesting for them to come into the education part. So these are the one of the projects which is ongoing, a project which is ongoing. So presently we have raised the books for the library and the education center. We are trying to build up a team for that. So we are doing a lot of awareness classes, career guidance classes to support our project. And our future projects, I'm going to talk about our future projects. We are planning to, I also mentioned about the hygiene part of this Paniya community. So we are trying to build a hygiene product manufacturing unit. For example, we are skilling the women how to make soap, hand washes, and toiletries, and all the phenyl, all the liquids, or all the hygiene products whichever is required for them. So we are training. We are planning to train these women on upskilling on the basic things. So they do not need to buy them from outside. They can make it for cheaper cost. So that is one of the projects we are going to implement on future. And also we are thinking about their menstruation in the woman. They are still following the old age methods like using the cloth instead of sanitary napkin. Today, in a era we are living, we are using menstrual cups, tampons, and everything. These women still are using this cloth for their for using as a substitute for the sanitary napkin. So we are planning to make a unit for a sanitary napkin. Also, parallelly, we are thinking of starting a solar cooking machine unit, because these women also travel kilometers and kilometers, 4 to 5 kilometers every day for collecting firewood, so that they can come back home and cook food. So, in order to solve that particular issue, we are also planning to start a solar cooking machine unit. So I also would like to thank BASW for giving me the opportunity to speak in this webinar for the social work month in March. Thank you so much.
Thank you. Fantastic, Auntie. That was really interesting. It was a very holistic look at how the pandemic has affected the community. You spoke about family life, you spoke about the economy, the community itself, and issues that arrived. And I think some amazing work through the projects you are doing to respond to some of those challenges that have arose from the pandemic. Thank you for sharing those reflections with us. Next up, we have Stefano, who will be talking about how the pandemic impacted the communities in Malawi.
Hello, everyone. My name is Stefano Joseph. I'm a social worker from Malawi. I'm mainly from the practice side, practicing social work. I've been practicing for 17 years. In Malawi, I'm the acting Secretary General for the Association of Social Workers in Malawi. Now, I want, first of all, to give what I call the background of social work in Malawi. As I've said, from this side, Malawi social work training started with a community development certificate. That was in 1964 at Magomero College, and this is a government training institution. And later in 1978, the college introduced a certificate in social welfare that produced the first card of social welfare assistance. That is according to the archives in the 1980. And these were mainly trained on need basis by the Ministry of Gender, Community Development and Social Welfare. What that implies is that it was the ministry that was training social workers then at certificate level just to suit the need of the ministry, to place them at district level to make sure that they respond and address to social work issues. And this was not sufficient until late in 2006, when the first degree program was introduced by a private university, that was Catholic University of Malawi. And as of 2016, 3 more universities offered degree programs. And despite this long history of social work had not really been fully professionalized. Social work in Malawi was essentially seen as an urban phenomenon and directed at migrants and juvenile delinquents who pose a threat to urban living. So what it meant was actually in communities, people were just living like the normal setting, the Ubuntu sort of I am because you are, that type of setting. But then in town, because of urbanization, then there were people that would migrate, and these were rendered like destitute. So there was need for these people to be actually supported, like to be linked close to back to their homes and so many things. That's where maybe the issue of public assistance really came on, and the issue of maybe delinquency as a result of life in town, the street connected children, and so many things. So that needed as the social workers to intervene in those problems that are arisen because of urbanization in the major cities of Malawi. We have 3 cities, we have 4 cities: Las Blantyre, Zomba, Lilongwe, and Inzuzu. Next. So the COVID pandemic is one of the key things that has really challenged the delivery of social work in Malawi, and crucial and very important has been the fact that for the first time we experienced issues of like, I would say, a lockdown like it is in other countries, but the slowdown in as far as economic activities are concerned, the movement, the economy slowing down, which led to so many stress and so many social problems. The background is that we are aware that the COVID, the first onset was in around December globally, but for Malawi, it was on 20th March that Malawi was declared a state of disaster, and subsequent preventive measures were put across to try to mitigate the spread of the coronavirus. And these were issued by the president then, and the measures included the following: redeployment of health personnel in all border posts, and the continuous screening and surveillance of people at all entry points. This included our airports. We have 2, Chileka as well as Kamuzu International Airport. So that screening really started, and suspension of hosting of international meetings and banning of all public servers from attending both regional and international meetings being hosted by the affected countries. By that time, we had known that the virus is present in this and so many countries. So there was that closing of all schools and colleges. Let me elaborate that. During that time, the schools were closed, and they remained closed for a period of 9 months or thereabout. So I'll be able to talk about what happened later in my as I present. But also there was all restrictions of all public gatherings to less than 50 people, and the restrictions apply to all gatherings, including weddings, funerals, church congregations, and rallies. You know, here we value so much people going to church, and the churches would host as far as maybe 2,000 people or thereabout, and so many rallies, gatherings, weddings, which would host also so many number of people. So there were those restrictions, and also funerals here in this side, they also attract a lot of people. So there were all restrictions of those, and the temporarily banning all government meetings. That also was one of the issues, and the safe or institutional quarantine of returning residents and nationals from coronavirus affected countries. So those are some of the measures that were really put across. So how were the social workers now really? How did the social workers come in? So we were looking at the efforts or the work that the social workers have been doing in line with the COVID-19. And these are some of the issues. One, the social workers have been ensuring that protection issues and concerns, especially of returnees from South Africa to Malawi, are adequately addressed. What I mean there is that in Malawi, we have a lot of people due to hard economic times. Sometimes we have a lot of people that are flocking from Malawi, that are migrating from Malawi to South Africa and looking what we call for greener pastures. They are working there in the informal sector. So as a result of a lockdown in South Africa, most of these people were forced to be returning to Malawi just to make sure that they are back in their country. But then by that time, South Africa had had registered many cases of COVID-19. So what was happening was that these people were coming in buses by road from South Africa via Bedbridge, Zimbabwe, Mozambique, and to Malawi. They were entering through Mwanza. So in that capacity, social workers from both government as well as non-government organizations were being supported to make sure that the protection issues of these people that were returning from South Africa were really addressed. So what we would do as social workers, we are deploying social workers from both government and as well as organizations such as Save the Children. So we'd go to the border, address while the medical personnel were addressing issues of testing, immigration, we're addressing immigration issues. Social workers also were ensuring that children, unaccompanied and children that were also coming, and the many people that were frail, expectant mothers, and so many people were adequately received and provided with the needs. Also, we ensured that messages of protection. We know that in a crisis like this one, it is also times that the issues of abuse thrive. So we're there to protect, to provide the messages in terms of protection, how they can effectively seek services, prevention of gender-based violence, and so many things. So the social workers were part and parcel of that response. But also, apart from that, we have street-connected children. So we were facilitating the reintegration of the street-connected children. At first, we advocated for the street-connected children in Malawi are pushed to the street because of the poverty levels, issues of HIV and AIDS that has led to so many children living as either single or double orphans. So we were also involved in the issues of reintegration of street-connected children. This also is one crucial area that the social workers were involved. And when you talk about reintegration, it involves the whole range of systems and steps, like identifying the children, assessing them, tracing their families, facilitating linkages with their communities so that they are moved to their communities, and also monitoring and ensuring that they are really settling down in their communities, providing psychosocial support and ensuring that they are enrolled in schools, and also at times also facilitating linkages with the social protection systems that are there in their respective communities. Further to that, at district level, social workers from both the government as well as the NGOs were also involved in the coordination, protection cluster coordination. When you say the response in Malawi is scheduled in such a way that there are clusters, and one of it is protection, which looks at the protection needs of the people. So social workers were involved in coordination and protection, ensuring that protection issues are addressed in the response. This is also one of the crucial issues that I will address in the next point, because when COVID initially came to Malawi, when the first cases were registered, I think the initial focus of the country was that this is a health issue. And we focused on testing, we focused on whatever. But when the schools were closed, the nation really started registering a lot of cases of child marriages, a lot of cases of teenage pregnancies, and so many, to the extent that I've given the figure in terms of teenage pregnancies. Within that period of 9 months, a total of 12,995 cases were registered, and a cumulative total of 44,874 cases of teenage pregnancies were recorded. This is very high. This is unexpected, but it happened as a result of the closure of schools. Really affected the learners. Some of them were misinformed to think that maybe schools will never open again, and much of the schools were closed as a COVID-19 prevention measure. But inside the communities, the children were moving, life was like normal, they were able to meet, date, and do whatever. So that really led to a lot of effects, and one of the key results has been this thing. So we have been raising awareness in the communities, be able to record. We conducted, as a nation, we conducted a rapid assessment to appreciate the situation. We developed systems that are going to address them, facilitate linkages to these children, to be linked to annul the marriages, and make sure that the children have gone back to school. Those that are married, because the law here says that you cannot, a child is any person according, under the age of 18, according to our constitution, which is also section 23 subsection 5, as amended in February 2017. But also this is aligned to other international documents such as the CRC and so many documents. So we also, some of the people that were involved in those, especially those older people that were involved in those malpractices of, or maybe having affairs or carnal knowledge with minors, they are also prosecuted. So social workers also were involved in that. But also we have been involved in facilitating the creation of child-friendly spaces, safe spaces, to ensure protection needs of children are addressed. This is also another crucial aspect that our social workers in Malawi have been involved in working to make sure, both from government as well as from the civil society partners, to make sure that we address the protection needs through the child-friendly spaces. Because if the child-friendly spaces that are safe and secure for children are not provided, what happens is the alternatives are the ones that are leading to children into problems, getting pregnant, and so many other things. And also we have been involved in the provision of psychosocial support remotely and directly to victims and those affected by COVID-19. I think this has also been a very big issue that social workers have been involved. Currently, we have been involved in issues of mental health and psychosocial support, working together with our colleagues in the Ministry of Health. There are now interventions that have been established. One of the key things that we have in Malawi, we have what we call childcare institutions, CCIs. So one of the key things that we did as a COVID-19 prevention measures, social workers in line with the CCI owners or childcare institution owners have been involved in the process of reassessing the children that are in the institution to say, okay, these are the children that are in the institution. But then issues of in institutions where there are many children, where issues of COVID-19 prevention measures cannot be adhered to, then the social workers really were involved in a program called reintegration. It's already under implementation in other districts in Malawi, especially the city districts, Blantyre, Lilongwe, Mzuzu, Mangochi, and Data. But also we were involved in assessing children from the CCI to make sure that these children are integrated back into their community. One, as a COVID-19 prevention measure, which allows for issues of prevention of issues of overcrowding, and also maybe if you keep children, many children at one place, issues of adherence to measures may not be possible. So that has been a very big issue, so that social workers have been involved in to make sure that reintegration really happens. So we have been involved in the general case management. When we say case management, I've been involved in assessing in the communities, for example, what is happening in terms of the issues of abuse, violence, abuse, exploitation, and neglect, and on a monthly basis assessing the data, looking at the physical abuse happening in the communities, the emotional, the social abuse, the neglect, child marriages, child labor, child trafficking, and so many other issues that are happening. And one of the key, COVID has brought in the issue of fear, especially in most of people that have, because of the messaging that we have. As a result, one of the key things that we have now as a country is that for the first time, the Ministry of Health is now recruiting social workers. Specifically, these are called hospital social workers. We have the interviews that are going to be done just this month. We're going to have social workers that are going to specifically work in hospitals. This is also very important and a milestone. And maybe this opening also is going to offer a space to our graduating social workers to make sure that they join the profession and become hospital social workers, work alongside the nurses and what have you. This is the first step that we have, like we have the specifically recruited cadre of social workers that are going to work in the hospital. What we had previously were that social workers from that are based maybe at district level would occasionally visit the hospital and provide the hospital social work services, but that was not sufficient. As social workers in Malawi, we are beginning now to get that recognition that we need as a country, and we believe that social work delivery in Malawi is going to grow and reach higher levels.
I think big thing. Okay, I think that might have ended a little bit abruptly, but thank you very much for that, Stefano. Again, it was a very interesting outlook how the pandemic affected the community, particularly relating to some of the existing challenges that were already there. You were talking about child marriages and teenage pregnancies, and how sort of a very holistic overview in terms of how the pandemic really impacted the community. So thank you very much for sharing those reflections with us. We're now going to go to the question and answer part of the session. So I will start, and this is, I mean, this is for everyone really. The audience member thanks all the speakers and says there's some very important accounts of practice. I wonder if some of the roles and practices that social workers have adopted during COVID-19 can be continued or adapted for post-COVID era when we get there. Also, do you think that the profile of social work as a vital service in a time of a pandemic has been raised? Should we start with you, Stefano? So it's about the profile of social work. Do you think it's been raised in this time? And do you think any of the practices from this time you would take post-COVID?
Thank you very much, Mariam. It's really important. And I should say, like for Malawi, as I have said, indeed, the profile of social work, or the fact that social workers are essential service providers, I think the recognition has really become more pronounced in this time as opposed to the previous times when we didn't had COVID. Obviously, as you have said, let's start with the hospital. Basically, there has been a great need that now that we need to have social workers that are working in the hospital. For us, we have always been advocating for that, to say we need social workers within the hospital setting. But that was really being ignored because people didn't see that as necessary. But now looking at the COVID, the fear, the stress, and what have you, a lot more people now we have recognized. And as I have said, interviews were conducted. By the time we were doing the recording, the interviews had not been conducted. The advert was just out. But what I can say now, you look at the agency that has happened. Currently, social workers have been recruited and have been placed in all the hospitals. That signifies the need. Secondly, as I have said, on the issue of child marriages and the increase in abuses, the initial thought is that the schools are the safe places for children and not the homes. But then when the closure of schools happened, what happened was that now we realized that we started registering an increase in number of issues, like the number that I've talked about, 44,000 cases of child pregnancies and the over 12,000 cases of child marriages. So this has also necessitated that we develop interventions that are targeting child protection. You know, one of the key things that we have been experiencing in Malawi has been limited or low funding to issues of child protection. But I can tell you with that, the Ministry of responsible for children has managed to release about 100 million kwacha, which is a very big chunk towards issues of child marriages. By the way, today, as I am talking, I'm speaking from a hotel where we have just concluded a meeting where we are developing what we call a community action engagement tool, which we are going to engage the communities in as far as addressing issues of child marriages are concerned. So I would like to agree with you, Maria, to say the emergence of COVID on the scene has really helped, one, to increase the profile of social workers, but secondly, also to help to shape our interventions and increase our awareness in as far as protection of children is concerned. So yes, indeed, it has been bad that we had COVID, but in terms of social work now, we have seen the much recognition. But maybe also let me, as the last point that I would like to raise, I have talked about the issue of returnees. I would like to, at first, the thought was that this is a health issue, but where only our colleagues from the health were involved without social workers, the whole thing, like the managing of the returnees, usually had ended up in chaos, where people would riot, would fight, and what have you. But when the social workers were called in to say, no, this also has a social aspect, I am telling you, we have managed to handle the returnees in a very dignified way. That signifies the relevance of social workers. So social workers now have been involved from the planning as well as the execution of all the intervention. So I would say, in a nutshell, the emergence of the pandemic has also exposed, one, the child protection system in Malawi, but also called for the need for social workers to be able to be involved in national issues as well as protection and addressing various issues that concerns the human beings. Thank you very much. Over, Maria.
Thank you. Jacob, what about you? So it's thinking if you're taking any of the practices that are now happening during COVID and maybe using them post-COVID, but also how the pandemic has impacted the profile of social work.
Yeah, I think I would say that we've learned quite some positive and negative aspects, I think, from the COVID-19 experience as social workers. And I should mention that, as Stefano has alluded to, COVID was really taken as a health issue alone, where the focus was really on testing and treating. But I think with time, they realized that, yes, we needed social workers to be engaged, for instance, in providing psychosocial support, and also even when it came to managing what we called quarantine centers, where those that were coming from, COVID-prone countries, entering into our country, were put aside for, say, like 14 days in quarantine. So social workers were engaged to provide services, meaning then that social workers were recognized as essential to work side by side, health workers. But I think going forward, I think what we pick from there is that as social workers, we need to continue providing, psychosocial support, especially in disasters, even when there is, a pandemic. And I think that is a great lesson. And also, when it came to issues to do with contact tracing, I think in this case, social workers were relied upon to, help colleagues in the health sector. So I think these are some of the lessons that we need to carry on as social workers in terms of, how we should be able to intervene going forward.
Fantastic. And Lynn, I don't know if I'm saying that right. Liam, go on. You can help me out.
Yeah, I can help you. It's Lamia.
Okay, Lamia, yeah. And the same is to you, just in regards to the profile of social work and any practices that you will take going forward.
Yeah, I can tell you that because I was working in a corporate world before, but after the pandemic has hit the world, like I have to quit my job. Obviously, we know what's happening around the globe, but the second option I was thinking about is like going to the social working field, because I know there is a need in there. And like this is a very difficult time for social workers to get out and work, as they are the frontline workers. And like the number was like very insufficient, where if it is like thousand or lakhs of people were there in the ground. So there were challenges in for social workers, but particularly like doctors and all the medical field workers. The social workers were having this challenges, like they will have to go to the field and look after each person, and have to be in contact with with people. So if there is a some traces of positive cases come in there, like routes, they have to go for quarantine, and all those things were there. But the possibility or the availability of things to do was like high in this time, as we see in our like state in the time of flood. And as we are like in a vulnerable state, we are living we see people coming together in the time of disasters, pandemic, and all those things. Yeah, that's it.
Fantastic. Thank you very much. Thank you for all three of you sharing some of those thoughts. This question is for Jacob in particular. Are there any arguments against the principle of Ubuntu, and how would you respond to them? So I think you spoke about the Western concept of individualism, I guess, which would maybe be an argument against the principle. But are there any more in the community, and how would you respond to them?
Yeah, so in terms of any arguments against Ubuntu, I think I think one critical one is the same issue of individualism. I think Ubuntu, yes, understands that an individual is important and problems that an individual is facing are important and need to be taken care of by the community, but also that an individual has got has got a responsibility to contribute to the well-being of the community, to the well-being of the group. So yeah, then I think the other aspect in terms of Ubuntu, maybe for me, I can also speak in connection with COVID. What I saw also this time around with COVID is that there was a lot of disruption in the way of life for us Africans, because as Africans we value togetherness, we value community life, and even when we're talking about issues to do with weddings, people just come whenever there is a celebration, and but then there were these restrictions as a result of COVID, like that there should only be a certain number of people attending this function, even during burial, when there's somebody that has died, that there should always be very few people. So all these issues have been in conflict actually with our way of life and the principle of Ubuntu, and it's really been a tough time to just get used to this. There's been this issue of physical distancing also, and issues that were limited to visit other people, our neighbors. Even when there's somebody that is sick, it is actually a part of our life to visit the sick, to encourage the sick. But then with COVID regulations, we find that we're limited, and that I think has been a bit of a problem in terms of adhering to the principles of Ubuntu.
Yeah, no, I can imagine when the whole concept is about togetherness and connection and being together, and we've been told this whole time to socially distance. It's completely the opposite, I guess, of what Ubuntu stands for. Thank you very much for sharing that. This question is for Stefano. Could you let us know how social workers can and should respond to the growth of teenage pregnancies?
Yes, Mariam, thank you very much. Social workers at professional as well as professional level are really what we would call the agents of change. So at national as well as district level, one of the key things is that we've been trying to come up with the relevant programs, policies and strategies. Firstly, I think for Malawi, how we have approached the situation is that we've conducted what we call, it started with the issues just coming out in the media, people reporting like so at such a school or a district, so many children have been impregnated and what have you. But then we didn't have a picture of what is happening on the ground. So what we did was we conducted a rapid assessment that informed our intervention. So one of the key interventions was the rapid assessment that was conducted. Firstly, to establish a baseline of what the situation is all about. And then indeed the baseline confirmed the assertions that were going on to say this is indeed a big problem that needs in action. One of the key things is that we social workers have worked at both the awareness level, which is now raising and mobilizing the community to be able to take action. We have groups in the community, we have influential leaders. In Africa, Malawi, Zambia, where Joachim comes from, we have chiefs. We have used them actually in addressing the issues at that community level. But apart from that, also we have used, social workers have been used to provide the psychosocial counseling, so that at least we be able to do that. But apart from that, as I have said in the presentation, to say some of these acts that children are the perpetrators are doing, they constitute what we call the violations, and the law is there to protect those children. So social workers also have been there to move the courts
to make sure that all those cases are really taken to court and the perpetrators have been are punished. And we have seen a lot of cases moving because of ourselves. I'll give you a very big example of what we are doing just right here in Blantyre, where I am practicing. We received a case of a certain area where 12 girls were impregnated. Actually, we went there, worked with the police, assessed the situation, and all the people that were responsible for that, the couples have been arrested and are behind bars. So social workers have been working on that. But apart from that, one of the key things that push children into the issues of marriages and what have you are issues of poverty and sometimes even lack of integration of services. So what we have done as social workers is to ensure that those that are vulnerable are linked to the social services that are there. But apart from that, also raising the awareness with the communities to ensure that they know that these are issues that whenever these things are happening, then they have to know what we call the complaints and feedback mechanism. Where are they going to report? And if they report, what are the issues that they are supposed to expect from that? The helplines that are there, we have tried also to popularize them to make sure that maybe where there is no paraprofessional, maybe it's because maybe they are very far away from the district or other areas, then definitely they can talk and address the issues to report to where the nearest social worker is, so that the issues are addressed and then they get the right help. So social workers really are doing quite a lot to make sure that the issues that are there are really addressed, and then protection issues of children are addressed.
Fantastic. It's amazing to hear that you're being so proactive in regards to, like you said, the perpetrators and fighting for that social justice. It's fantastic to see that work being done on the ground. I'll do one last question before we wrap up, and this is to Lamia, but it can be open to anyone else. But it's looking at the concept of domestic violence, which we know here in the UK, where I'm speaking from, has become a big issue during the pandemic. Has this also been an issue in the local area? And how have you responded to the issue if it's become one during the pandemic?
Yeah, Mariam, I'm so happy to answer this question. So there are several research studies happening in our specific place about this household harassments and like family violences and abuses, sexual abuses within the family happening. Unfortunately, this topic is not under our objective of the study we shared here, but like we witnessed a lot and we were working along with these things. If I'm talking behalf of my institution, MS Swaminathan Research Foundation, we have been giving trainings to these women, and we are like giving like as Stefano said, classes, like awareness classes, and how they can tackle the issue if it happened to their life, and like whom they have to report, and all those things, like the real factual things they can apply on their lives. They have been provided these facts and these informations, and like this is not a issue of pandemic. This is happening since ages, and this and it is not related to patriarchy in this specific region, because this is like not matriarchal but like not patriarchal kind of a community that we were talking about. So it is not even about patriarchy, but this kind of things are happening, but very less compared to the general community. And women are having good status, better, I can say better compared to the state. So harassments and like sexual abuses and family abuses are happening, but it is comparatively less. But due to in the time of pandemic, it is happening more, because people are sitting in their home, they are not going out. So the activities we are doing, as I mentioned, is like making them able to speak up and making them financially independent with the projects we were doing, and making them a space to talk, and making the community, like the women as a folk, and making them united in itself the community. This were the activities. This is not a short-term activities. This is what me our team, as our foundation has been doing from the beginning itself. Yeah.
Fantastic. Thank you very much for sharing that. That we've come to the end of the event. I want to say thank you to all three of you for your contributions. It's very interesting because sometimes when you're in this pandemic, say me in the UK, you can only think of the pandemic and how it's affecting where you are, and it's nice to have a wider perspective of actually this is something that the globe is going through, and to hear that. So this event marks the final session of BASWA's England Week of Action for World Social Work Month, and we'd like to thank all our speakers and members for everything you do and have done in the last year. The BASWA World Social Work Series for this year will continue from Monday with the Scottish Association of Social Work Scottish Parliament 2001 event. So please do book your place via our website. And thank you very much for everyone who spoke and who joined us today. All right, take care, everyone. Bye-bye.
Yep. Bye.
Bye-bye.